welcome to today's virtual lunch meeting. My name's Sam Chkoskin. I'm the Sales and Marketing Manager for the JCN, and I'm just going to run through a couple of bits of housekeeping before we get started with today's session. So today's session is titled Mepilex Border Comfort, Innovation in Every Layer, and we are very lucky to be joined by two speakers today. We have Natalie Milne, who is the Bordered Foam Product Manager, and Jonathan Boswell, who is Key Account Manager. And today's event is sponsored by Mölnlycke. So a massive thank you to both our speakers today, and also to Mölnlycke for supporting this event and being able to put this on for free for you to get some valuable education. So certificates are going to be available at the end of today's broadcast. There'll be a link in the comment section and on the slides, and you'll be able to download that and put that in your CPD folders for revalidation. Please do bear with us. You'll notice we are filming this remotely, so if there are any technical issues, I'm sure there won't be, but we'll be working on those behind the scenes, and there'll be someone from our team in the comments section making sure everything is okay and you know what's going on. And finally, please do get involved with today's session by leaving any questions you might have for Natalie or Jonathan in the comment section. If you have any questions or comments, please leave them in there. We'd love to get your feedback and questions through for the live Q&A at the end. So that's all from me. I'll now pass you over to today's speakers, and I will see you for the live Q&A. Thank you very much.
Thanks for that, Sam. Hi, everyone. First, thanks for joining us this afternoon. It's nice to see you. So yeah, what we're going to talk through to you today about is Mepilex Border Comfort. So starting off with the first slide, in the UK, there's many challenges associated with wound care. There's certainly something that's been highlighted by the guest data, which some of you may be actually familiar with. So firstly, the obvious thing is that wounds need to heal. And with those wounds, those patients need care. There's actually 3.8 million wounds in the UK that are requiring care. And nurses from that need that time to see those patients. There's 130 million visits across practice nurses, district nurses, and healthcare assistants. And this obviously leads into the budgets, and budgets are tight within the NHS at the moment. There's a lot going on with inflation as well, which we all know about in the news. But the cost of wound care itself was actually 8.3 billion to the NHS, and 81% of that cost was actually found in the community. The challenge is absolutely finding that dressing that's conformable, stays on as long as needed, and without compromise. So with that in mind, we're introducing Mepilex Border Comfort. So that's our next generation flexible dressing, and that's designed to stay on and uniquely conform. So the key aims that we're kind of trying to address with the dress now is we want to give that time back to nurses. So we're incorporating new technology into a product that's already trusted and known by clinicians up and down the country. What we want to do is kind of reduce those dressing changes and start to promote self-care for patients as well. We want to give cost savings. So within the new dressing, we're going to be improving the product that you already know, but we want to ensure that there's no cost increase passed on to you as well. And finally, provide quality of life for patients. So we want to kind of find those marginal gains that can help improve the patient experience. We all know it's quite traumatic for patients to have a wound. We want to find those gains, those marginal gains that can help improve that patient experience. So if we take a little closer look at Mepilex Border Comfort, so it's designed to stay on and uniquely conform to the wound and the patient due to its flex technology. So we will go into that a little bit more thoroughly throughout the presentation. So as you'd expect, it offers smart Exudate management capabilities, and with SafeDAC reduces pain and damage to the skin. So again, what we want to do is give you that familiar product, but with those enhanced properties as well. So let's take a little bit of a closer look across all 5 layers of Mepilex Border Comfort. So firstly, the back-in film layer, and this has a new Exudate progress monitor, which allows you to objectively assess the spread of Exudate across the dressing. So this will give clinicians and patients the information that they require then to make that dressing change when it's required and not before. We want to support undisturbed wound healing, reduce dressing changes, and better cater to patients with self-care. in mind. In the retention layer, we trap bacteria away from the wound. So the superabsorbent fibers work to hold that bacteria away from the wound bed, and we also prevent any of that bacteria from re-entering the wound, and that's even after compression as well. So our flex technology that is then found across the retention and spreading layer, this allows for 360-degree flexibility across the Mepilex Border Comfort. So this was something that was already found in our surgical dressing, which obviously with things like orthopedics, now you need to get the limb mobile again and moving, which is very important. It has to be flexible with the skin, and this is something we want to kind of bring to more complex wounds, really, where you see quite fragile skin around the wound itself. The spreading layer then will maximize capacity within the dressing by channeling that exudate. So the exudate is actually channeled away from the wound and then over to a wider surface area. So this increases moisture vapor loss and reduces the swelling across the dressing itself. Obviously that reduction in that swelling makes it a little bit more comfortable for your patient and helps conform as well. The foam layer allows for rapid absorption of both normal and viscous exudate, and the rapid absorption and minimal swelling allows for maximum capacity. And finally, something that you probably will all be familiar with is our SafeTac soft silicone wound contact layer. So what that does is it reduces pain and damage to the skin at every dressing change. So more than 58% of patients complain that a dressing doesn't pull or move with their body. That's why we did incorporate 360-degree flex technology into Mepilex Border Comfort. It adapts and shapes to the movement of the patient. So as you'll be able to see with the animation, flex technology allows Mepilex Border Comfort to move in every direction with the patient. This therefore reduces overall skin stress, increases comfort, and keeps the dressing in place for longer. So actually 9 out of 10 patients feel that their wound impacts their quality of life. So Mepilex Border Comfort, which contains SafeTac technology, is proven to reduce pain and trauma to the skin and is absolutely preferred by patients. So this just goes into a little bit more depth of what SafeTac actually does. So SafeTac technology actually means less pain and trauma during every dressing change. And what you'll see there is more traditional adhesives where skin stripping can actually occur with those more traditional adhesives. SafeTac helps to minimize and improve that patient experience at dressing change. So we appreciate that, obviously having a wound can be a pretty traumatic time for any patient, and anything that we can do to improve this needs to be absolutely considered. And in a recent study, 93% of patients actually preferred dressings with SafeTac. And finally, Mepilex Border Comfort can actually be left in place for up to 7 days. So this, in combination with our smart exudate management and our exudate monitor, should contribute to fewer dressing changes, supporting undisturbed wound healing and giving back time to clinicians, ultimately kind of reducing the impact on your budgets and your time. So thanks for that. I'm now going to pass the baton over to Natalie, and she'll go into it a little bit further.
No problem. Thanks a lot, Jonathan. So Mepilex Border Comfort is designed for every stage of wound healing. It's versatile and really easy to implement into everyday practice. By choosing Mepilex Border Comfort, you can simplify your dressing choices, as it's suitable for both acute and chronic wounds. And it also has the capability to manage exudate from both moderate to highly exuding wounds across multiple different tissue types, as you can see on the screen. Meaning the Mepilex range can be used for every stage of wound healing, from inflammation through to granulation through to epithelialization. And depending on the level of exudate, you can either step up or down across the range, moving from Mepilex Border Comfort to Mepilex Border Light as the wound improves and that exudate reduces. So I'm going to talk a little bit about Mepilex Border Comfort Smart Exudate Management capabilities. These allow you to have the confidence to leave Mepilex Border Comfort on for longer and still maintain that optimum wound healing environment. This is due to the rapid vertical absorption and horizontal spreading of wound fluid and exudate within the dressing. And as you can see from the animation on screen, exudate is rapidly absorbed from the wound bed. This is then channeled away and spread over a larger surface area to increase that moisture vapor loss and reduce swelling, to increase the overall efficiency of Mepilex Border Comfort, and also to make it as comfortable as possible for your patient, helping to support that undisturbed wound healing that we all strive for as clinicians. The superabsorbent fibres in the retention layer lock exudate away and prevent exudate containing bacteria from re-entering that wound bed, even under compression, to help protect the wound bed from maceration and fluid ingression. And as you can see from the video, the backing layer helps to prevent the wound from external bacteria and increase that moisture vapor transmission loss, increasing the amount of fluid that can be taken on by a Mepilex Border Comfort. So with Mepilex Border Comfort, it offers rapid absorption with minimal swelling. It maximizes capacity by channeling the exudate and trapping it away from the wound bed. And as Jonathan said, you can track this exudate without even removing the dressing to help reduce unscheduled dressing changes and to save on nursing time. All of these can give you the clinical confidence to leave Mepilex Border Comfort in place for longer, helping to support undisturbed wound healing, all while maintaining that optimum wound healing environment. And when we tested Mepilex Border Comfort against other foam dressings on the market, Mepilex Border Comfort outperformed several other products, some by as much as 265%. I'm now going to talk you through how the Exudate Progress Monitor actually works. So with Mepilex Border Comfort, you can track and record exudate, allowing you to leave the wound undisturbed, as this is known to assist in wound healing. The Exudate Progress Monitor can give you the clinical confidence to leave the dressing in place for up to 7 days. And the dots printed on the backing film help to track exudate and wound fluid as it spreads across the dressing surface. These dots are 1 centimetre squared and allow exudate to be assessed and recorded without even removing the dressing, so leaving the wound undisturbed, which could mean fewer dressing changes for the patient, less wound disturbances, and a reduction in overall nurse time and resources. And as Jonathan said, this could also help to support self-care, giving patients the confidence to be involved in their own care, knowing when and how to change their dressing. So when would you actually look to change a Mepilex Border Comfort? It should be changed once the exudate spreads past the green zone highlighted on the screen, or at the point of 7 days, or when clinically is deemed necessary. We also have patient information leaflets, which are available from many of your key account managers, which can be given out to your patients. These help to educate patients about their dressing and when it needs to be changed, which can help with that supported self-care. On the reverse of these, they explain that the discoloration on the dressing is absolutely completely normal and nothing for them to be concerned or worried about. In fact, it highlights that the dressing is supposed to look like that, and it shows that the dressing is actually doing its job and absorbing wound fluid in the way that it should do. With Mepilex Border Comfort, you get a product that stays on and uniquely conforms due to its proprietary flex technology. And in a recent quality improvement program, Mepilex Border was implemented as part of a skin tear pathway. By using Mepilex Border Comfort, they were able to increase the wear time from 3 to 7 days. And across the QIP, the average wear time was 6 days, and 78% of these wounds healed within that 7-day period, which resulted in a significant cost saving across that department due to a 57% reduction in the number of dressings used across that department. I'm now going to run through a patient case study that used Mepilex Border Comfort. So a little bit about the patient. It was a 60-year-old male that presented at their MDT clinic with a neuropathic diabetic foot ulcer who was being treated for osteomyelitis. The wound was located on the plantar first metatarsal of the right foot and measured 700 millimeters squared and had a depth of 30 millimeters. The wound consisted mainly of slough. There was no clinical signs of infection and moderate levels of exudate were present, and the peri-wound area was considered to be healthy and intact. So what the podiatrist did, treatment with Mepilex Border Comfort was commenced and monitored over a 28-day period in conjunction with standard of care, which is a removable cast for offloading. And over the course of the 28-day evaluation period, the patient attended 4 follow-up visits at the podiatry clinic, and at the follow-up visits, the dressing was either changed according to local clinical practice or when the dressing became saturated. So as you can see in the first picture, this is how they presented on day 1 with their diabetic foot ulcer at the clinic. And by day 14, you can see that the wound had reduced by up to 51% and the peri-wound area was considered to be intact. In the final image, or at the end of the evaluation at day 28, the wound area had reduced by up to 80%. And across the evaluation of this wound, a total of 8 Mepilex Border Comfort dressings were used, and the median dressing change frequency was every 4 days. The podiatrist involved rated Mepilex Border Comfort on average as excellent across numerous parameters, such as its ability to manage and handle exudate, the ease of application and its stay-on ability after application, and the ease of removal without causing pain or damage to the skin or the patient. The podiatrist reported that Mepilex Border Comfort provided excellent exudate management and facilitated a reduction in the number of dressing changes required per week. And all information about this case study or any other case studies that Mölnlycke do can be found in our Case Finder app, which is freely available on our website for clinicians to check and use and keep up to date with any of our case studies that we're doing. So to summarize, with Mepilex Border Comfort, you get that familiar product with enhanced properties. It's up to 11 times more flexible than other foam dressings due to its proprietary flex technology, and it can handle up to twice as much exudate than other foam products on the market. And we know that 9 out of 10 patients prefer dressings with safe tack compared to those with traditional adhesives, allowing for greater confidence in Mepilex Border Comfort, giving you that familiar product, but with enhanced capabilities. On the screen, you'll be able to see the codes and sizes for Mepilex Border Comfort, so you can easily incorporate them into your everyday practice. And if you'd like to know any further information about anything discussed throughout today's session, please feel free to contact your local key account manager or get in touch via our website. So that's it from myself and Jonathan. We'd just like to thank you for taking the time out of your busy schedules to come and join us today. And I'll pass back over to Sam, who I think is going to open the floor for questions. Thanks a lot.
Brilliant. Thank you both. That was really, really interesting. And we've had lots of people watching, and some fantastic questions have come through so far. So do keep sending in your questions. We'll get through as many of them as possible. And if we don't get through to yours, then we will try and answer it after the event as well. I did notice one comment asking whether the recording and the slides will be available afterwards, and they will be. They'll be this recording will be available on our Facebook page or on our website, and you can download the slides from our website as well in about the next 24 hours. So keep an eye out for those as well. Okay, so moving on to the first question. This one's from Julia Baker. Is a primary dressing still required with a shallow wound, or will this dressing conform to the wound bed?
Do you want me to take that one, Jonathan?
Yeah.
So with the Mepilex Border Comfort, it will, if it's a shallow wound, it will conform to the wound bed, and you shouldn't require a wound contact layer as the wound interface, because when Jonathan mentioned on some of the slides earlier when he was talking through the layers of the dressing, one of the layers of Mepilex Border Comfort has our SafeTac technology on there. So actually that's the same technology that's in our wound contact layers such as Mepitel 1 and Mepitel. So it's actually already part of the dressing, so you get that 2-in-1 product. So that should you shouldn't need to require a wound contact layer as that wound interface against, and it will contour to the wound bed, and it should ensure that you should get that atraumatic removal because of the SafeTac technology within the dressing.
Perfect, thank you. And I will ask all these questions to both of you. Feel free to jump in whenever you like. They're not targeted at anyone specific, so feel free to jump in whenever. The second question is from Julie, and Julie asks, if there's a wound cavity, can it be used alongside packing of the cavity, or does it eliminate the need for packing?
Yeah, it's not going to eliminate the need for packing. I think that's probably alluding to a product that kind of 3D fit and all the rest of it goes into the cavity. It's not going to go into the cavity itself. There still will need to be similar packing. Another of our products actually, Exufiber. If you do get the chance to look that up online, do so. There's actually a really interesting little bit of work on that, of how it passes Exudate from the cavity up to the dressing itself on top. So yes, you would still need to use something, but it will, like I said, if you were to use Exufiber, for example, it would actually pass it all the way up through to your Mepilex Border Comfort.
I think also as well, when you thinking about the amount of wounds that require to be packed, I think it's about 20% of the total number of wounds across the UK are cavity wounds. So if you do have a cavity, you know, and I would always follow your local policies and procedure as to what depth that is, then you would need to pack out underneath the Mepilex Border Comfort. But if you've got a shallow and diffuse wound, such as on a venous leg ulcer, say for instance, then there's no reason why you would need to use a gel fiber underneath the dressing. And the only reason that you would need to is if, say for instance, that was one of your main objectives with the wound. If there was too much wound fluid that was coming from the wound, then you could incorporate a gel fiber underneath it to help manage the exudate better. But I think it just depends on, if there's a cavity, then always follow your local policy and guidelines.
Brilliant, thank you very much. Question 3 is from Alison. What about problem areas such as the sacrum? So for the sacrum, it all depends on your local policies and procedures. I know we do have Mepilex Border Sacrum, which is still available on the market, so you can still use that for your sacral ulcers. But if you did want to use a Mepilex Border Comfort because of the enhanced technology within the dressing, say for instance, we don't have a sacral dressing currently, but you can use the squares on a diagonal. And it just depends on whether your trust advocates using shaped dressings for sacral ulcers or whether or not they've moved away and advocate using square ones. But Mepilex Border Sacrum is still very much part of our range, and you can use that. Brilliant, thank you. Question 4 then, can you use the Mepilex Border adhesive dressing on lower legs?
Yeah, absolutely. There's no reason that you can't do that. Still, yeah, like I said, gentle atraumatic removal because your SafeTac technology, enhanced capabilities in regards to how it handles Exudate. And you also got the Exudate monitor as well, which will kind of lead into the patients with their self-caring as well. So patients can actually apply the dressing themselves if they need to. And yeah, it can be used, just to address the question, it can be used on lower limb.
Yeah, and I think also as well, if it's used on a leg ulcer, say for instance, you can use Mepilex Border Comfort underneath sort of your hosiery kits if you're, you know, if your patients are self-managing, or if that's, you know, the route that you've chosen to go down, because it's going to manage that fluid. And I suppose also the National Wound Care Strategy suggests a simple non-adherent dressing that's cost effective. So again, a Mepilex Border Comfort is absolutely acceptable to be used in that instance.
Brilliant, thank you. We're on to our, well, it's our final question from Andrea, but there's two parts of this question, so I'll start with the first part. With use in areas such as the heel, can the corners be cut and overlapped to give better conformation?
I mean, I think what I will say on that, regardless of the you know, about cutting it, what we would say is that in terms of conforming to those more difficult areas, now we've incorporated the flex technology within the dressing, what you should start to see is that the dressing is more conformable and easier to conform. I think in the case study that we just showed in the presentation, one of the things, you know, it was stay on ability, it was conformability that was rated highly by podiatrists, which is, you know, often really difficult to dress areas. So that incorporation of the 360 flex technology will, you know, enable clinicians to dress areas more effectively.
Perfect. And on to the second part of that question is, can it also be used with Inadine or Idaflex?
Look, I would always follow your local guidance as into what your local formulary states, but there's nothing to say that you can't use the products mentioned underneath ours from a, you know, a packing perspective, or whatever you're hoping to achieve from a debridement point of view. Then yeah, that's absolutely fine.
Brilliant. Well, thank you very much for answering all of those questions. Really interesting presentation as well. Like I said, if you did miss any of it, any of our viewers, then you can watch it back in full on our Facebook page, or you can watch it back on our website and download the slides from there, where you'll be able to see all the questions as well. Thank you, Natalie, and thank you, Jonathan. You were brilliant today. And thanks for answering all those questions. For more information on all the topics discussed in today's session, you can contact Mölnlycke by visiting www.mölnlycke.co.uk, and that link should also be in the comments section. And the certificate link should also be in the comments section now, so you can download that and use that towards your revalidation. Download a certificate that will say the title of the session and your name on that as well. That's it from us today. Please do make sure you follow our Facebook page, and you'll be able to see all of our future events. We'll have plenty more in the new year. Yeah, that's all from us. Thank you very much for joining us, and enjoy the rest of your day. Cheers.
Brilliant.
Thanks.
Take care all.